This is Daniela Tudor and Murphy Jensen. They are responsible for an incredible new app that can help people as they work through their recovery for addiction. Tell us a little bit about, just give us the basics of WeConnect and how it works.
Sure. So WeConnect came about through my own experience of getting into recovery. And essentially I found out that at the end of a treatment program of 28 days, all that usually you get is a piece of paper telling you all of the things you have to do every single day to stay in recovery. So the genesis of the idea was first to build a patient-facing mobile application that keeps you accountable and connected with positive reinforcement and rewards to keep you engaged and on track with your recovery and really connected 24/7 to your support group. And so as a result of that, when we piloted in treatment centers, we realized that treatment centers didn't have a good way of collecting the data in real time to help intervene and help people stay on track. So then we also developed a data dashboard with a patent-pending risk score algorithm that actually takes into account your behavior on the app to give that data in real time.
So, and that you bring up a couple of questions that I wanted to ask you about. Firstly, how well does it usually go for people who finish that 28-day program and then just have a piece of paper to work from?
Yeah, so the statistic, sadly, is that 80% of people relapse in the first 60 days of recovery. And, you know, this is the biggest public health crisis of our time. Millions and millions of people are affected. 23 million in long-term recovery, 20.8 million people a year trying to get into recovery.
Wow, that's an incredible statistic. And it just keeps growing, doesn't it?
Yeah, it's growing right now, but with our product specifically, we've seen amazing results that's reducing the chance of relapse. So.
Then talk a little more about that value of having support, because, you know, it's no secret that 12-step programs and having people to, you know, to sort of collectively help each other out can be helpful, but having that support after treatment has a lot of value, doesn't it?
Yes, basically the crux of staying in recovery is accountability to your recovery activities like the meetings or therapy sessions or whatever works for you. And second is staying connected to your counselor, to your support network, your loved ones. And what the app does is it enhances that human connection in real time, because essentially you have your support network having visibility when you are maybe isolating or you're not at the meeting, and it really bridges that huge gap in between those activities.
So I'm not great with math, so I'll have you avoid the heavy math, but one of the things I was curious about is how you assess somebody's risk for relapse.
Mm-hmm. So we did a meta-analysis, our data science team, of tons of evidence-based research. It's called contingency management. And they saw this type of research reduce the risk of relapse by 50% when using rewards and positive reinforcement to keep people motivated. So for example, Tate, one of our very first customers, he's completed in the last three and a half years 98% of 7,000 recovery activities in our app. He uses that to stay accountable and get reminders about going to the different locations for his recovery activities, which our app encourages and checks you into. And he also uses the Starbucks cards that he gets as rewards to take newly people in recovery to coffee and keep them connected and build a relationship with them.
There's something about coffee and recovery that seems to go hand in hand, too. It always has.
Mm-hmm.
And, you know, that's the other thing, too, I wanted to talk about is you mentioned the recovery activities. Walk us through a little bit how WeConnect helps guide people through and sort of keep them on track with those recovery activities and like some of the different ones.
Totally. So for example, Murphy actually tonight is going to a men's meeting, and so when he walks into that recovery meeting, the app automatically checks you in by verifying you're at that location because he opted to do that. And then instantly he'll get like a piñata in the app that really celebrates that achievement, and it gets him closer to that next reward, that next Amazon gift card or Starbucks card.
And it's also showing me what my next step, my next recovery activity looks like, where I need to be, when I need to be there. It's a framework that's going to support every single aspect of our recoveries.
So how do people who are coming out of recovery or while they're in recovery get help getting started with it?
Yeah, so basically we work with providers, so any kind of institution, outpatient, inpatient, medically assisted treatment clinic. We have an entire program that gets them connected to the WeConnect program through group therapy curriculum that we built, through swag. We give them this bracelet with the We Connect values on it when entering the program. And at the very end, the counselor onboards them onto the We Connect app with their care plan. So essentially that piece of paper is completely digitized, and they walk out of it prepared with a tool in their pocket that's sort of the best version of themselves, is how I think about it.
Well, go ahead, I'm sorry.
And the goal for us as a company is to take that journey from day 28 to day 365, and using all the technology that we've created, to get someone to day 365 with the support of all the key stakeholders, which include family. Family is a big key to this, because addiction is a family disease, and without the support of my loved ones, and left to my own devices, I might be struggling. So they get notifications and things that are going to alert them when my recovery activities drop below a certain threshold.
And getting someone to day 365 of recovery drops their chance of relapse by 60%. So really focusing on that first year is sort of the biggest milestone that they can hit to set them up for a lifetime success.
But it never really ends, does it?
No, and that's the thing why this app is so important, is that you have to continue to stay accountable to your recovery. It's a chronic condition, and that's actually one of the things that we are changing the landscape of the addiction world, because we're moving the system from looking at it as an acute model of care, where you just throw someone in detox or a 28-day program and you think you're done, to extending that to a lifelong of treatment for your chronic condition. Just like with diabetes, you have to take your insulin on a daily basis. You have to check into these activities on a daily basis for the rest of your life.
Wow, that is amazing. Now, you had mentioned it, you plug in all your activities and that sort of thing. Now, I'm a guy who lives by the virtual string around the finger that is into my phone now with pop-up reminders and all that. Is that how that part of We Connect works?
Yeah, so there's notifications that keeps you motivated to continue on the journey, and even the small sort of animated rewards in the app are based on research. University of Washington did a research on how digital apps across all ages and demographics keeps people motivated in behavior change for behavioral health, and so we use that to make the app fun and engaging throughout their journey.
And I think at the end of the day, keeping my recovery front of mind, like you said, with the string around your finger, that's going to remind, keeping it front of mind is going to strengthen my ability to say no to the first drink or drug. And, the fact that we're producing a tool that's going to support, prevent relapse, and change the world of recovery. There's never been anything this complex, yet easy to use, and designed beautifully. I'm really proud of the work that Danielle and I have done, and for me, being an ex-professional tennis player, and this is the most important work in my lifetime to date.
Wow. So, can we get a look at how it works?
Yeah, for sure. So, Murphy, do you want to show him the app?
Well, you'd be best to walk. You're closer to the camera.
So here he's on challenge 5. He's got 2 days left, and it looks like here he's done one support activity, which is those in-person location verified activities, and then self-care 5 out of 5, which is all of the other things you need to do for recovery, like meditation, even creative endeavors, praying, those types of things. We're program agnostic, which is really important. And that means that we support all pathways of recovery, not just 12-step, but therapy, community support, all those different things. And here he has his schedule. He's completed morning meditation and prayer. And we can check into an activity here. And it'll count that towards his total achievement.
And
So
check us into East Side.
all right.
That's a tonight activity.
So it actually asks you, it doesn't look like you're at your current activity. Do you want to check in? And here is where it gets really good. He checked in. However, here he gets a positive message saying, wow, you nailed it. And then if we go over to the dashboard over here, if I'm a clinician, I can see the entirety of all of my current patients and their risk levels. So we can click into Murphy, and here it can highlight location-based routines. So green means that he was at the location that he assigned to this activity. Here it means he was actually 6 miles away of that scheduled activity that he had planned on going to. And then here's our algorithm that actually looks at risk score level trend over time. So he started at high risk 100%, but now he's been checking into more activities, so it's decreased over the time. And for a clinician, it's really important in recovery. They're overworked, underappreciated, they have huge caseloads. So to be able to see that data really quickly when we did focus groups was really important.
So the geolocation stuff verifies that side of it. Where's the verification on the self-care other than taking you at your word?
Yeah, so self-care is more on the self-reporting side, but the support routines clinically, going in person to therapy and going in person to those meetings is what is weighted the most in the algorithm because those are really the most important ones. On self-care, we're just getting tons of data, what else works for people. And then we'll be able to also help guide providers to improve treatment.
Wow, that is absolutely amazing. Now let's talk a little more about the rewards because you know, we have seen this figure $1,000 a year, but it's a little bit at a time, isn't it?
Yeah, so over the course of the year, looking at the science behind of how many rewards and the timing of when you get them throughout that first year of recovery has been basically built on this body of research. And so on the front end, the first 90 days that are most critical, even for creating your profile, you get immediately your first reward, and that keeps people really motivated in those first few months, which are the toughest.
And where are you getting the rewards to give to people?
Oh yeah, so we work with a third party that has a huge selection of different rewards, and the basis and the ethos for the rewards is health and wellness rewards, rewards that are known for in the recovery community, like the coffee you mentioned, and then also rewards that improve your quality of life. So we work with Volunteers of America, for example, in Los Angeles, which is all veteran population, and we've gotten feedback that the rewards, a lot of them are coming from being homeless off the street, have also helped them improve their social determinants of health or their quality of life overall.
Unreal. Now, there's obviously going to be questions about people's privacy. You're talking about their health care issues. How do people protect themselves and still make use of this app?
Absolutely. So it's all voluntary, and we're HIPAA compliant on both platforms. We don't share the data unless they consent to share that with their third-party clinician. And everything is very secure in the private cloud. And so we actually, from day one, I got a chief compliance and privacy officer at the company. She was like employee number 4, because I know privacy by design is really, really important, and we want to keep people's data safe and protected.
But some of that stuff you need to share with your clinician in order to be able to not only work the program, but work through the app too, right?
Yes, and so they opt into it, and actually our chief privacy and compliance officer, she's also got a sense of humor, and she's really friendly, and so the way that she built the consents into the app, you know, usually when you see a terms and conditions, it's like really long, nobody reads it. She's actually pulled out the most important pieces so that they're clear in a couple sentences, and it lists very clearly this is what you're opting into if you choose to. And so we want to give as much transparency and visibility to the customer as possible.
How about dealing with the insurance companies? Because I know sometimes they are involved if you're getting treatment that is being paid for by your insurance.
Yeah, so the insurance companies are actually interested in aggregate anonymized data to look at comparing the different treatment centers and their success. So that's how they're looking at that data. It's not by individuals or, violating any kind of privacy. It's to look at aggregate population data for treatment center A, and if they're having better outcomes in treatment center B, then that's a motivator for those providers to improve their modality of treatment to continue to get reimbursement for the insurance companies.
So, as I understand, we're just out with essentially WeConnect 2.0. What's different from the original?
Oh my gosh. Well, we took in lots of feedback from our first version, and first off, we partnered with one of our investors, is the CEO of MetaLab. They're the company that built the UI and UX for apps like Uber and Slack. So the UI and the visual aspects of the app are really user-friendly. They're super loving with the animations and everything like that. So the look and feel is completely different. We just built on our relapse risk score algorithm, so it's much more robust and built out. And then with contingency management, we also built that out to a whole other level, really looking deeper at the research, the timing, and the amount of the rewards. In our past platform, it was Starbucks cards at the same amount, and it was over strict periods of time. This is really built on a hockey stick of when is it actually important to get the rewards to keep people motivated.
Excellent. How's the success rate been so far?
I mean, it's been received really great. We just started deploying on our second version to our first set of providers, and so we're starting to get really, really amazing feedback from both the provider side and the patients, and yeah, we're just really excited.
And we just signed our first deal.
Yes, so we just signed our first deal with the health plan out in Pennsylvania, and we're excited to implement that over the next couple months. It's going to start covering in-network providers in Pennsylvania first, and then build out from that. So.
And you had mentioned feedback, so let's take that one piece at a time. On the user end, the people who are going through treatment, what are they saying to you now that they're working through it?
Yeah, I mean, they're saying it's like really fun, it's pleasant, it's a delight. I've had comments that it's making them feel like loved and a part of a community. And I don't believe that that's just the app. It's really the We Connect ethos. It's also the swag that we're giving them to really show them that they're now part of the We Connect community. And, you know, addiction is something that should be talked about, and people should feel comfortable being open about in terms of being able to get the proper aftercare that they need.
How about on the provider and the clinics?
Yeah, so with the clinics, I mean, it's saving them time. You know, like I said, counselors are usually overworked. They have a huge caseload. They were still doing things on pen and paper, taking notes, and then having to enter them into the EMR. With this, they take one look at the dashboard. They know who's at risk, who they need to get in touch with that day. They don't have to chase people down or anything like that. So this is just huge from that respect. And then for the health plans, they have the ability to really mandate improving treatment because they're seeing that comparison provider to provider. Usually after day 28, it's all been, you know, once a year self-reporting data. They would call the patient once a year as a provider and see if they're still sober. Now that's not very accurate data, nor is it helping the patient. So just across all the three different stakeholders, the feedback's really positive.
Well, that is fantastic. Daniela Tudor, Murphy Jensen,